Email todayradio@rte.ie.
Now, the government's new measures for curbing the spread of COVID-19 have been criticised in some quarters for being confusing and contradictory. It seems that we will not be able to watch sporting events on TV indoors in a pub, but we won't be able to attend matches. We'll be able to go to mass but not meetings, to attend a wedding with 50 strangers but not have a family lunch with more than 6 in attendance. So for a reaction to this, I'm joined now by Chair of the Oireachtas COVID-19 Committee, Michael McNamara. Michael, thank you for joining us this morning. What's your reaction to this?
I look forward to the Minister and the Acting Chief Medical Officer explaining the rationale for the decisions. I mean, we're told that the government acts on the advice of NPHET and that NPHET acts based on science and medical evidence. So I'm really looking forward to them coming before the committee to explain why these measures have been taken, why they're necessary, and ultimately, I suppose, what is the objective of our COVID strategy. I mean, at the very start of this, we were told that the objective was to flatten the curve so that, yes, COVID is among us and would stay among us and would spread, but the objective was to limit the spread so that our health system wasn't overrun. Now, we have a rise in detected cases. That's not necessarily a rise in cases because we don't know how many cases are out there, but we do know that detected cases are rising. But interestingly, we're not seeing a rise in hospital admissions, in ICU admissions and in deaths, thankfully, and that's mirrored right across the United Kingdom, Europe and other countries. So I suppose, is there an anticipation that we're going to be different, that the rise in detected cases in Ireland is somehow going to lead to our healthcare system being overrun, whereas other countries, I think, are a little more hopeful that that won't be the case.
And of course, the argument against that, or the reason for why we are being more restrictive, made by health professionals in the country, is that our health systems can't cope. We can't compare it to other countries, our health system, because, our ICU capacity, for example, is much less.
Absolutely, and we do need to hear the explanation for that. And also, restrictions were put in place while our capacity was increased. So I suppose it's important to hear 6 months on what capacity has increased. I do know that the CEO of the HSE explained at the last committee meeting how many ventilators had been purchased. It was a sizable number. I don't remember the number off the top of my head, but I mean how our capacity has increased and what steps are being taken in the long term to bring our healthcare system up to a standard that would be able to deal with the pandemic if there's another pandemic in a number of years' time. I appreciate that Rome wasn't built in a day, it won't be fixed overnight, but what steps are being taken. And also testing and tracing has been key. We've been told testing and tracing was the key sort of weapon of the state's armoury from the start. And it's a little bit worrying to hear that testing times, the committee in an interim report suggested that people should be tested and have the results back within 24 hours. The HSE, the last time they were before the committee, were moving in that direction. There does seem to be a suggestion now that there's a lot of slippage on that, and that's something that would be worrying and that we need to get an update on.
Well, the Minister, speaking to us just a little earlier, Minister Eamon Ryan said that is something that they are focused on and that they are going to address, and he admitted that there had been problems with that over the last couple of months in terms of not having it ready. One of the other things he was saying in relation to the restrictions that were announced last night, Michael, and the apparent contradictions therein, is that these are choices that have to be made, and the choice, for example, that a wedding might be more important than a children's birthday party going ahead, and you can understand that. Can you understand, even though they may be contradictory on a public health perspective or from a public health perspective, that there have to be some decisions made rather than telling everybody everywhere you can't go anywhere and you can't do anything?
But I suppose, increasingly we are moving with more and more restrictions, and I suppose what I'd like to know is what is the justification restrictions that we took a different approach to the rest of Europe with regard to international travel. Obviously, there was a lot of commentary about that over the weekend, but yesterday on the RTE 1 o'clock news, we heard from the Deputy Chief Scientist at the European Centre for Disease Control that based on the evidence they were receiving from EU member states, evidence that cross-border travel was in fact contributing to the rise in COVID-19 cases, and that testing and tracing locally were much more important measures to take. So I do appreciate that people follow the advice by and large. People sacrificed quite a lot. A lot of people didn't go on holidays and lost money, but now it does appear from what we were told that measure wasn't necessary. So I suppose, but that's come and gone. The point is, what is the basis for the measures that are being taken now? And right now, I'm not aware of any other countries that are limiting outdoor gatherings to the extent that we are, because up to now we've certainly been told that outdoor gatherings were relatively safe and it's better that people meet outdoors rather than indoors. Now we seem to be moving away from that. I'd like to know why and what the basis for that is.
Today with Sarah McInerney on RTE Radio 1.